Hi everybody, Markin, the dentist, and another dental MacGyver. In this episode I am going to show you how to put the rubber dam on in another situation. This time in case of restorative treatment, when we are going to treat some second class cavities. In here, teeth 1/7 distally, 1/7 mesially, and 1/6 distally. So we have 3 cavities to treat. So we need to place our rubber dam on at least 3 teeth, 1/7, 1/6 and 1/5 here. So this is our patient for today, and our set of tools and the rubber dam. Today I'm going to show you this one, not the classical one. The forceps, applicator, wedge, some rings, and the clamp for the rubber dam, also dental floss and the scissors. Okay, so in this type of rubber dam, with scissors we are going to cut some holes in the rubber dam, because the area for teeth, the areas for teeth are marked with the profile of the rubber. So we know where to cut. We have our holes here, and this is the anterior type. So in fact this is only to first molar, but it doesn't matter. You can use this last hole for the second or for third molar if you need. There is the other type, posterior one, in which you have those marks for teeth up to 7, but only for one side. So it depends on what type of rubber dam you want to use. I prefer this one because of its profile and because of the ergonomic frame, which for me is more comfortable, but it doesn't matter. Rubber dam is the rubber dam, and this one is just more expensive, but if it is more comfortable to work for me, it is worth it. Okay, we take our clamp for molars. In this case we put it on into the hole. We take our forceps, we put it on our clamp, and we lock it. So we have it set for the patient. And we go to our patient, and we are going to put the rubber dam on. So we release the forceps with the lock. We just first put the clamp on the teeth. We take with our finger, we remove the rubber from underneath the clamp if it's stuck in there, and we leave the clamp on the teeth. Then we are going to take the applicator, and we put the rubber underneath the wings of the clamp very easily. And now we have to, I will just rotate my patient here, And now we have to get our holes and put the teeth through it. So to do it, you just make the rubber wider and you first position your teeth underneath the holes, and then you just press a little and push and pull right and left, and the rubber should get through the contact point. If you have a problem with it, you can make the rubber wet a little to reduce the friction. You can do it with water or maybe with some glycerin, it doesn't matter, but when you have less friction, the rubber will get through the contact point much better. I know that on this model there are not tight contact points, but trust me, if you make it wet, you are going to go with it very easily. If you still have a problem, you take a dental floss and you go with this floss through the contact point. Remember, always have the rubber a little wet or lubricated, and when you use the floss, always go from the occlusal surface by pressing a little on the contact point and then get the rubber through the contact points from the distal side and from the mesial side. Couple of times, sometimes you need to do it, but after that you are going to succeed. Don't go through the middle of the contact point, because if it's tight, you are going to break the floss or you are going to make some additional hole in your rubber, and it's really something you don't need to and don't want to. Always get your cavity at least primary prepared before you start, because it is easier to get through opened contact point and not through not fully opened cavity with some sharp edges, because you are going to break your rubber. And again, with the applicator, you are going to push the rubber underneath the edge of the cavity. Here it is easier with the applicator, but you have to be careful, because if you have here thin part of unsupported enamel, you can break it. So you have to be really careful here in this area. And after that, you are going to invert the rubber dam with the applicator. It is important to do it, because if you want, it's going to be leaking. And that's it. Sometimes, if it's really tight, really difficult, I don't know, here through the contact points, and sometimes the contact point is very low on the gum level, sometimes you want to take the wedge and push the rubber with this wedge underneath the contact point. This is one of the possibilities if it is tight. Sometimes also you can do it here, but you have to be careful not to make additional holes in the rubber. And sometimes you can just simply take the ring for the restorative treatment for reconstructing second classes, and you can put it here for a couple of minutes and after 30 seconds, 60 seconds, teeth will get separated and you will be able easier to do what is shown before. So trust me, if you do it like this, there is no as tight contact point that will not let you to put your rubber dam on, and you will be able to go with restorative treatment using rubber dam every time. So that's it for today. We have talked easiest situations, putting rubber dam for root canal treatment in previous episode, and this situation for restorative treatment of second classes, easy second classes, and I will show some next tricks in upcoming episodes. Take care, see you next time.